Hello, today is Tuesday, September 7th, 2021. It's Dr. Rhonda Johnson, and today I'm going to be discussing ivermectin. But first, what is ivermectin? You've probably heard about this on TV or through social media. Ivermectin is a medication that treats some parasitic diseases. There are two forms of this medication, one's for humans and one's for animals, and prescribed by veterinarians. So let's talk about the human medication. So what conditions is it approved for? Well, it's approved by the FDA for two indications, and they both have to do with parasitic worms. One is strongyloidiasis, which again is seldom seen in this country, and onchocerciasis, which is commonly called river blindness. Again, seldom seen in this country. Now, there's also off-label use of ivermectin, and that means that doctors prescribe it for something that it's not approved for. And typically, it's prescribed for other types of parasitic worm infections in humans, and for head lice and pubic lice, even though it doesn't have FDA approval for that. Now, we're talking about COVID-19, and ivermectin, folks, is not approved to treat COVID-19. It has not been shown to be effective in well-designed clinical trials. There have been some trials, but the results are not conclusive. It's sort of in that same category as hydroxychloroquine. You know, for a while there was a lot of talk about hydroxychloroquine being a treatment for COVID, and studies didn't bear that out. Now, I'm going to be fully transparent here. There are doctors, unfortunately, who are prescribing ivermectin for COVID, just like they prescribed hydroxychloroquine for COVID, even though it's not been approved for COVID. But this is why I'm doing this video, because I want to spread the word that respected institutions such as the FDA, the Infectious Disease Society of America, the National Institutes of Health, the World Health Organization, and the CDC do not recommend ivermectin for COVID-19 unless you're enrolled in a well-controlled professional clinical trial. Now, in some developing countries in the developing world, they are using ivermectin because they don't have many treatment options for adults with mild COVID. So again, it's not recommended. I know you'll be able to get your hands on it because it's an oral drug. It's prescribed. It's available for some conditions. It's cheap compared to other COVID drugs, and people are desperate for anything to help combat COVID-19 infection. But just know that it's not approved, and if you're thinking about taking it, you could have an overdose, which could cause seizures, coma, and death. And certainly make sure you're not taking the animal form that's available on the internet. That should only be available to large animals like horses, under the care of a veterinarian. So that's my message today. I hope this helps. As always, my views are my own. My only intention is to help save lives. Folks, the vaccine has been approved. There's one of them that's fully approved by the FDA for 16 and up. That's the Pfizer vaccine. And the Moderna and the Johnson & Johnson COVID vaccines remain approved under emergency use authorization for adults 18 years and up. That's my message. Have a blessed day.